Hi, Dr. Brian Heaberlin here with Lexington ENT and Allergy, and as we start to head into the cooler months, we're going to see more upper respiratory infections and sinus infections. And so, what can you do at home to help reduce or prevent or treat a sinus infection? So that's what I'm going to go over in today's topic. So when we get a virus that gets into our nose, we get these upper respiratory infections. And so most upper respiratory infections are viral, or at least they start as viral. Now, some of these can progress to be a bacterial infection, but usually there's a viral phase up front. And so our sinuses are these air pockets that form off of the nose. We have the maxillaries, we have the frontals, we have the ethmoids in here, and in the back of the nasal passage we have the sphenoid sinus. And those sinuses have very narrow drainage pathways that pass the mucus that's produced in the sinus into the nasal passages. And so when we get swelling from an infection, it's easy for those sinus outflow tracts, we call them, or those little openings that drain the mucus into the nose, to get occluded. And when they do so, the oxygen concentration within the sinus changes. There's a chemical called nitrous oxide that'll be there, promote more swelling. Bacteria that is already in the nasal passageways can then start to infect that mucus that's there and the mucosa, which is the lining tissues around the sinus, and leads to a secondary bacterial sinusitis. So usually when you get a sinus infection, a bacterial sinus infection, it started as a virus and then it kind of morphs into this bacterial infection. So if we can try to cut this off at the viral upfront phase, that'll reduce the need for antibiotics. And we would like to be on as little antibiotics as possible because antibiotics kind of kill everything, kills both good bacteria and bad bacteria, and they can cause side effects and allergic reactions and things. So we want to really try to limit the amount of antibiotics that are needed. So you don't need an antibiotic when you're in the second or third day of an upper respiratory infection, because it's just viral. You're just exposing yourself to side effects of those antibiotics and not really helping yourself at all. And so what can you do? So if you get a cold, you're in the second or third or fourth day of the cold, some things that you can do at home. So oral decongestants can sometimes help. Recently, I think it was the FDA that came out and said the kind on the shelf, the phenylephrine, didn't really even get into your nose and really wasn't very effective at all. So I guess that means we're back to using the Sudafed, the pseudoephedrine, which is the one you have to get showing your license to the pharmacist and getting that kind. So oral decongestants can try to help. The way they try to help is by shrinking those nasal membranes a little bit, by reducing the blood flow to those membranes, and that will try to let those narrow sinus outflow tracts open back up a little bit. Using nasal rinses, I think, is a big benefit. So the sinus irrigation systems, there's a couple of different ones. One called NeilMed that we recommend a lot, can help try to flush out some of that mucus that's there and just try to keep the nose more clean. Usually it does kind of feel good to the people who are having an upper respiratory infection as well. Using some Afrin. We don't like people using Afrin long term, but using it for symptom relief and maybe even helping to improve outflow tract drainage in the sinuses could be helpful. Just you're not supposed to use it for more than 3 days because you can get this rebound swelling and kind of a nasal dependency associated with it. So, but using it for a couple of days when you have a cold is not necessarily a bad thing, probably a good thing. Any of these symptom relief medications, that have, often it's a combination of a pain reliever like Tylenol along with a decongestant, along with some other things to try to dry up the mucus. Antihistamines don't really help a sinus or an upper respiratory infection, but some of the older style antihistamines may dry up some of the mucus and it may help symptom relief, although it's not probably going to change the course of things. And so the majority of the time, though, these viral URIs or upper respiratory infections will not progress to a sinusitis. Usually they will start to improve on about day 5 to 7. And then by the time 7 to 10 days are going through, you may have a little residual cough or postnasal drainage, but the majority of the discomfort and congestion have started to improve. And that means you do not need an antibiotic, and you just need to kind of let that process go. The average Adult gets about 3 upper respiratory infections a year and shouldn't really get a sinus infection with most of those. Now, some people are certainly prone to, and some people were certainly going to go on to develop a bacterial secondary sinus infection, and those are the people that would benefit from an antibiotic. So one of the best ways to know the difference between the two is the duration of symptoms. So if you're 7 to 10 days into the cold and you're getting worse, not better, you're starting to develop upper teeth pain, the drainage that you get out of your nose has changed more from clear from white to more of a thick yellow, even greenish kind of discharge. Those are some signs that it might be bacterial, but the best indicator is really the duration of symptoms to let you know whether something's bacterial or not. So don't seek out antibiotics for those very short-term problems, up to 5 to 7 days if you're not getting, if you're improving some by that 7-day mark. I would not recommend an antibiotic at all. So again, maybe oral decongestants, maybe some topical nasal decongestants like Afrin could help. Using nasal irrigations can help. Maybe some topical, symptom relief medications like Mucinex and other things to try to thin out the mucus. Those are all good things that could help an upper respiratory infection. But sometimes it's just time, really. And so that's just a discussion between the difference between the two and what over-the-counter things you can do to try to help some of your nasal symptoms with this cold season that we're going to start to see. I appreciate you listening. Thank you.